multiple awakenings during the night. The stream itself might become weak, hesitant, or implementing bladder training techniques, where you gradually increase the time between urinations, can help your bladder hold more typically announces itself with noticeable urinary symptoms. Early prostate cancer frequently presents with no symptoms at all. This lack of immediate warning signs can foster a dangerous complacency, or, conversely, a pervasive anxiety about the unknown. Men might mistakenly attribute any minor aches or changes to normal aging, potentially delaying diagnosis until the disease has progressed. The emotional toll can be profound. A diagnosis of cancer, regardless of its stage, often triggers a wave of fear, uncertainty, and a sense of vulnerability. Questions about prognosis, treatment side effects, and the impact on family and future plans can be overwhelming. Furthermore, the very concept of screening, the prostate-specific antigen, PSA test, and digital rectal exam, DRE, is often shrouded in controversy and confusion, leaving men unsure whether, when, or how often they should be tested. This uncertainty can lead to missed opportunities for early detection when treatment is most effective, or conversely, to unnecessary anxiety and follow-up procedures if the screening results are ambiguous. The fear of potential side effects from treatment, particularly concerning urinary control and sexual function, can also be a significant deterrent to seeking timely medical advice. Think about how this might apply to your own life. That quiet apprehension about an unseen threat that could potentially alter everything. This timeless wisdom reminds us that while our bodies inevitably change, our spirit and approach to life's challenges can remain vibrant. But what happens when those changes touch upon a part of ourselves that often goes unspoken, yet profoundly impacts our daily lives and well-being? We're talking about prostate health, a topic that, for many men over 60, moves from the periphery to the forefront of their health. Or perhaps a persistent feeling of not fully emptying your bladder. These aren't just minor inconveniences. They can be signals from your body, whispers that something might be amiss with your prostate. Understanding these signals, distinguishing between common age-related changes and more serious conditions, and knowing when to seek help is paramount to maintaining your quality of life as you age gracefully and powerfully. Before we dive deep into understanding prostate issues like BPH, cancer, and more, if you're looking for a community dedicated to embracing every stage of life with wisdom, joy, and practical strategies, make sure to hit that subscribe button right now on Aging Gracefully 60. We're here to guide you through the journey of aging, not just gracefully, but powerfully. One of the most prevalent and often perplexing challenges many men encounter as they mature is the gradual, yet undeniable shift in their urinary habits. This is frequently due to a condition known as benign prostatic hyperplasia, or BPH. Imagine this scenario. You're enjoying a peaceful evening, perhaps reading a book or watching your favorite show, and suddenly, an urgent need to urinate strikes. This isn't just an occasional inconvenience. For many, it becomes a relentless cycle of frequent trips to the bathroom throughout the day, and perhaps most disruptively, multiple awakenings during the night. The stream itself might become weak, hesitant, or interrupted, making the process frustratingly slow and incomplete. There's often that nagging sensation of still needing to go, even immediately after urinating, leading to feelings of anxiety and discomfort. This isn't merely a minor annoyance. The constant disruption of sleep can lead to chronic fatigue, irritability, and a diminished capacity to fully engage with daily activities. Social situations become fraught with anxiety, as the fear of not being near a restroom can limit participation in outings, travel, and even simple walks. The impact on intimacy can also be significant, adding another layer of distress. The underlying issue is that as men actually shrink the prostate gland over time, offering longer-term relief. Often, a combination of these medications can be overwhelming. Furthermore, the very concept of screening, the prostate-specific antigen, PSA test, and immense. Men may experience feelings of emasculation, loss of identity, and profound sadness. Partners, too. and couples therapy can be invaluable in navigating these changes, fostering communication, addressing emotional challenges, and helping couples redefine intimacy in ways that work for them. Support groups can also provide a safe space to share experiences and learn from others who have faced similar challenges. Furthermore, maintaining overall health through regular exercise, a balanced diet, and stress management can positively impact sexual function and overall well-being. The key is to remember that sexual health is a continuous journey, and while prostate issues can present challenges, they don't necessarily signal the end of a fulfilling, intimate life. With the right support, information, and proactive strategies, men can continue to experience intimacy and connection in meaningful ways. Imagine the renewed confidence and closeness that can come from addressing these concerns head-on, ensuring that your intimate life remains a source of joy and connection. The journey of understanding prostate issues often involves a series of diagnostic tests, and for many men over 60, this phase can be fraught with anxiety and uncertainty. The very mention of a biopsy can conjure images of discomfort and fear, while the nuances of PSA levels and other blood tests can be confusing. The initial PSA blood test, designed to screen for prostate cancer, is often a source of significant apprehension. An elevated PSA reading, while not definitive for cancer, can trigger surrounding the diagnostic process. If these initial screenings raise concerns, the next step often involves a prostate biopsy, a procedure where small tissue samples are taken from the prostate for microscopic examination. The prospect of a biopsy, with its associated risks of pain, bleeding, and infection, can be a major source of distress. Furthermore, the waiting period for biopsy results can be agonizing, a time filled with speculation and worry. Even after a diagnosis, the journey isn't always clear-cut. Sometimes the biopsy results are ambiguous, indicating atypical cells or PIN, prostatic intraepithelial neoplasia, leading to further monitoring or repeat biopsies, prolonging the diagnostic uncertainty. This diagnostic odyssey, characterized by tests, waiting periods, and often uncomfortable procedures, can take a significant emotional toll, leaving men feeling vulnerable and out of control. It's a reality that can be physically and emotionally draining, leaving one questioning every twinge and discomfort. Navigating the diagnostic landscape of prostate issues requires proactive engagement, clear communication with your healthcare provider, and a commitment to understanding each step of the process. When facing an elevated PSA or an abnormal DRE, it's crucial to have a thorough discussion with your doctor about the significance of these findings. Understand that many factors can influence PSA levels, and an elevated result doesn't automatically equate to cancer. Your doctor may recommend a repeat PSA test, a free PSA test, or advanced imaging techniques like multi-parametric MRI, which can help guide decisions about whether a biopsy is truly necessary, and, if so, where to target the samples more precisely. If a biopsy is recommended, don't hesitate to ask detailed questions about the procedure. What type of biopsy will be performed, e.g., transrectal ultrasound-guided or transperineal? What pain management options are available? What are the potential risks, and how are they managed? And how long until results are available? Understanding the process can significantly reduce anxiety. Post-biopsy care, including antibiotics to prevent infection, is crucial. If the biopsy reveals cancer, understanding the Gleason score and clinical stage of the disease is paramount, as this information dictates subsequent management strategies. For ambiguous or low-risk findings, active surveillance might be an appropriate and reassuring option, involving regular monitoring cycle of frustration and resignation, where men feel that they are simply at the mercy of their genetics or the aging process, rather than empowered to influence their own prostate health. It's a reality many of us face, that gap between knowing we should make changes and actually implementing them sustainably. Embracing a proactive approach to prostate health through mindful lifestyle choices is a powerful strategy that complements medical interventions and empowers men over 60 to take greater control of their well-being. The good news is that many of the beneficial lifestyle changes are not radical, but rather sustainable habits that contribute to overall health. Regarding diet, focusing on a balanced, plant-rich eating pattern similar to the Mediterranean diet has shown promise. This involves increasing your intake of fruits, vegetables, whole grains, and lean proteins, while limiting red and processed meats, saturated fats, and excessive sugar. Specific nutrients of interest include lycopene, found in cooked tomatoes, and omega-3 fatty acids present in fatty fish, both of which have been associated with prostate health. While supplements can be tempting, it's generally recommended to obtain nutrients from whole foods. Discuss any supplement use with your doctor, as some can interact with medications or have unforeseen effects. Regular physical activity is another cornerstone of prostate health and overall well-being. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity exercise per week, combined with strength training on 2 or more days. Exercise helps maintain a healthy weight, which is crucial, as obesity is a known risk factor for prostate issues, including aggressive prostate cancer. Stress management techniques, such as mindfulness, meditation, yoga, or spending time in nature, can also indirectly benefit prostate health by reducing inflammation and improving overall resilience. Furthermore, maintaining a healthy weight through a combination of diet and exercise is paramount, as excess body fat can influence hormone levels that impact prostate growth. Regular hydration by drinking plenty of water is also important for urinary tract health. It's about making gradual, sustainable shifts rather than drastic overhauls. Think about how this might apply to your own life, integrating small, manageable changes that collectively create a significant positive impact on your health and vitality. This isn't about perfection, but about consistent, conscious choices that empower you to age gracefully and powerfully, taking an active role in safeguarding your prostate health. As we've explored today, understanding prostate issues isn't just a challenge. It's an invitation to cultivate resilience, embrace new possibilities, and truly live life to its fullest. By understanding the common pitfalls and proactively applying these solutions, we empower ourselves to navigate the later stages of life with confidence and joy. From managing the common disruptions of BPH to proactively addressing the silent threat of prostate cancer, and from tackling the complexities of sexual health to embracing powerful lifestyle choices, each step we take is a testament to our commitment to a fulfilling and vibrant future. If this discussion resonated with you, and you're ready to embrace aging as an adventure rather than an endpoint, then please take a moment to subscribe to Aging Gracefully 60. Your support helps us continue creating valuable content designed specifically for you. Hit that like button if you found this video helpful, and share it with anyone you know who could benefit from these insights. And as always, remember to leave your thoughts and experiences in the comments below. Your perspective enriches our entire community. Together, we can redefine what it means to age gracefully.